I don't consider myself an expert, but I did write a dissertation on ADHD many moons ago. And in doing that, we evaluated over 300 children and their parents with, at the time, it was the Achenbach or the CBCL. CBCL. And so what we did was like interview parents and their teachers and to see, you know, what were the behaviors. And then we also did a correlation of, do they do better with therapy alone? Do they do better with medication alone, or the combination? And as you know, the research shows that it is the combination that has the most effect on ADHD. It's not curable. The parents will bring the children in and say, here, fix them. We can't do that, but we can help them manage the symptoms, right? All right, so we're going to talk about the definition and the features, the etiology, what are some of the evidence-based assessments and treatment modalities, and then specifically, I like what Russell Barkley talks about with regards to executive functioning and how it affects ADHD. Sometimes I'll say Charles Barkley, so forgive me for that. I know they're both very, well known, but Russell Barkley is who is relevant to ADHD. All right. So what is ADHD? It's a developmental disorder of varying degrees, almost like a spectrum, like autism. However, this has different subtypes. What we're familiar with is the inattention and or hyperactivity. The onset is in childhood. We have seen children as young as 2 years old who are more hyper than the average bear, right? And so they already have what I call these pre-characteristics of ADHD. You can kind of tell these are the children that are more rambunctious. They're very spirited. They present a challenge for daycare providers and their parents. And so the onset is at a very young age, but typically we don't diagnose it until school age, right? Parents probably want us to diagnose them early on, but at that point I think there's a lot of factors that we need to consider that aren't present, like school environments and things like that, okay? It's relatively persistent and pervasive. Now the good news for parents is that although in childhood, that's when the behaviors are the worst, when they're the most hyperactive, when they're the most inattentive, that it does get better as they get older. Okay, so I always give them that hope that, as they get older, things will improve. Plus, in addition to the treatment and therapy and sort of, them learning from just being in the environment that redirects them. It creates significant impairment in major life activities. So statistically, about 50 to 80% of individuals who have ADHD in childhood will go on to have it during adolescence and into adulthood. Okay, the characteristics are similar, but they vary. They do have difficulties in their life and functioning. And then it's not due to autism, although there's a lot of comorbidity with with ADHD, such as learning disabilities. Probably the most comorbid diagnosis that we see is ODD, oppositional defiant disorder, and a lot of conduct disorder. But if you have a child who has autism, they may also have ADHD, but it's not one or the other. Okay, so if they have autism, doesn't mean that they have ADHD as primary, or so you have to really sift that out and see what it is that's causing the problems. Okay. A lot of intellectual disabilities, I don't know if what came first, the chicken or the egg, that the learning disability come first or the ADHD. It's probably sort of interconnected. A child who doesn't focus and has difficulty concentrating is probably going to have academic problems. And so therefore, be labeled as having a learning disability. All right, what are some of the major characteristics? Again, it's a disorder of age inappropriate behaviors in two separate domains, the hyperactive component and then the inattentive component. So the hyperactive component, or impulsivity, means they have poor inhibition, their inability to control their thoughts. If they think it, they say it. If they feel it, they do it, right? So their inability to self-regulate, impaired verbal and motor inhibition. These are kids that are very fidgety, very, at the bottom you see they squirm, they run, so it's difficult for them to control their activity. And one of the research studies that I was doing basically indicated that these kids lack the serotonin or norepinephrine that in neurotypical individuals, we don't really need to self-stimulate to feel normal. But for them, because they're lacking that, there's not enough of that sort of spark, if you will. They have to create it by, banging or moving or, doing things. So those little spinners that they have that, supposedly help, well, that sort of helps not just distract them, but give them that, little ability to have something that's stimulating, because they can't do it internally. They lack that ability to do that, so they need that external stimulation for them to just feel normal. Okay? All right. Impaired verbal and motor inhibition, impulsive decision making. They can't wait or defer gratification. They don't know how to, everything is about instant gratification. I want what I want when I want it, right? They probably tend to come across as very egocentric. It's all about me. The world revolves around me. And so especially as they get older, they have problems with friends. Nobody wants, I've seen a child as young as 3 in a daycare where nobody wants him to be on their team. Nobody wants to be, for me, because the other kids, they understand sort of these informal social norms that we have that, this child always wants to be first, or he always wants to have the toy, or he pushes, or, and so after a while it does affect their self-esteem, and it's heartbreaking to see these children ousted by their own peers because of their behaviors. They don't want to behave this way, but they just, they can't help themselves. Okay. The greater disregard of the future, so not understanding the future consequences, that if you do this or if you said this, do you know there's going to be these ramifications down the line? Okay. And then excessive task, irrelevant movements, and verbal behaviors. So have y'all had any experiences with some of these children? What are some of the other behaviors that you see? Anybody in the classroom? So this is the child that you can tell right away if they have the hyperactivity, because this is the child who's off the wall, right? We probably, if you were a classroom teacher like I was, you remember their name, and you probably never want to name your child or your firstborn after him, right? So you're like, okay, I remember this kid, he gave me hell the whole year, so don't want to hear that name ever again, all right? So that's what hyperactivity looks like.
Does yelling count as
yes.
Because I hear about a lot of children that they're yelling and throwing things in classes.
Exactly. Yelling, moving, fidgeting. There's a lot of things that teachers can do to help allow for that, in an environment where it doesn't distract the other children. But we can talk about that later, where maybe they can allow for some wiggle room, if you will, just so that it doesn't interrupt the instruction. Okay? The inattentive component or subtype, there are at least 6. There are arousal, alertness, selective, divided span of apprehension, and persistence. So the inattentive child will look a little bit different. This is maybe a very quiet child in the back of the room, but he's just like, who opened the doors? The nurse is here. Is that for me? They don't cause problems for the teacher. In fact, they may go unnoticed, but this is a child who's very easily distracted, isn't focusing, and then when it comes time to produce, they didn't really hear half the stuff that they were supposed to, right? So when you get a lot of the referrals, it's probably going to be for hyperactivity and not so much for inattention until it starts affecting them academically, and then they're like, oh, they're failing everything. What's going on? Let's evaluate them, right? Not all are impaired in ADHD. What is? Poor persistence towards goals. So these individuals have a difficult time setting goals, like following to-do. One of the problems that they have is following multiple steps. So you can tell the child, go do this. By the time you got to the second or even the third instruction, they already forgot. They might remember the first if you're lucky. So one of the things to do is to have them repeat to you, what did I just say? Can you remember, or write it down for them so they can remember the multiple steps, because they're going to have a difficult time following through on tasks. They impaired resistance to responding to distractions. So like in the little video that you saw, there's a lot of distractions going on, that child is going to focus on those things. It's hard, you know, it's like this in front of you in the here and now, I can focus on it for all of 3 seconds, but then there's something else that came up and it feels just as important, so I have to focus on it. Okay. Deficient task re-engagement or following disruptions, so it's hard for them to get back on task. It takes a lot of effort and redirecting. Usually these are the kids and adolescents you want at the front of the class because there's too much socialization going on in the back. They get even more distracted, away from windows and things like that. So if you want them here in front of you, at least it improves their chances of being able to pick up on what's being said. Okay, impaired working memory, remembering things that they have to do. So it almost seems like they're defiant. They don't listen. I told you to do this and 5 minutes ago, and it's like you ignored me. When in reality, it's like they have a difficult time actually processing and retaining in memory the things that were asked of them, right? Okay, what are some of the other characteristics? Difficulties remembering to do things and working memory. So again, writing things down. And when I used to work with teenagers, I would have them write down the tasks. Like, what do you have to do this week? Have a planner. Teach them, I like, and I know it's an old book, but it's the 7 Habits of Highly Effective People, right? I think now they have the 7 Habits of Highly Effective Teens. You can teach the kids how to organize themselves. How do you write things down, the assignments that you have for next week and so forth. Because if it's out of sight, it's out of mind and you're going to forget. Okay? Adults with ADHD also have difficulty. If they don't write it down, they miss important timelines like appointments and meetings. And so, of course, they're going to have difficulties in employment. They have delayed development of internal language, what Dr. Barkley calls the mind's voice. We all have this ability to talk to ourselves, right? Doesn't necessarily mean we have schizophrenia, but we do that. We say, okay, well, you know, should I do this? You know, how long is it going to take me to do this? And we kind of process things, right? You know, and if I say this, what's going to be the outcome? And kids with ADHD, they lack that. They lack that inner voice. They don't have the ability to sort of think things through. If they think it immediately, they're going to say it. They have no filter. All right? They have difficulties with regulating their emotions, and this all has to do with the executive functioning. If you know anything about the brain, it's your frontal lobe, your ability to regulate or self-regulate. So this is the kiddo that's going to be more emotional. If they're angry, you're going to see it that they're angry. If they're happy, they're going to tell you that they're happy. And so as they get older, they almost seem like to be more immature because they really act out their emotions. So when something is stressing them out, they don't know how to just take a breath. It's okay, let's think this through, let's problem solve this. They're just going to act on their emotion, and then they're going to regret it. Well, it wasn't that bad, but I overreacted because I got really mad about it, right? They have difficulty with motivating themselves. It has to be very stimulating. If it's anything that lacks or that requires sustained mental effort, they're not going to want to do it, right? They want to get to the exciting part already. I don't want to read this whole book. Can I read the end already? You know, kind of thing. Diminished problem-solving abilities. So if we can teach our kids, our teenagers, how to problem solve, you're already halfway there, so that they don't feel like everything is catastrophic and, oh my gosh, you know, I can't take this. They lack ingenuity and flexibility in pursuing even their long-term goals. So I used to have this activity that I used to do with these kids, and I would say, you know, if we had an elephant, we could potentially eat it one piece at a time, right? So, you know, in theory, you can't sit there and eat a whole elephant, but if you wanted to, you could, one piece at a time. They're like, oh, that's so gross. Okay, well, but the reality is, if you have this project to do, you can do it a little bit at a time. It starts with first, you know, look up this one topic, and then it starts with writing one paragraph, and then put 2 paragraphs together, and by the time you know it, you have your paper written. But when ADHD individuals think about tasks, they get overwhelmed. They don't know how to say, okay, I'm going to break these things down little by little, right? The greater variability in their task or work performance. So they have a lot of difficulty in following through on things. A lot of them will lose employment or are underemployed because of this problem, even with medication and treatment. Again, because of all the difficulties and life problems that come with this disorder. How do we diagnose it? So that's something we do at our center. We have child psychologists, and sometimes parents will come in and say, I want my child diagnosed. Well, wait a minute, what does that look like? What does that mean? What do you need it for? And so sometimes they just need to know if the child, has these characteristics. So we usually start off by maybe doing a behavior rating scale. Everybody's heard of the Vanderbilt, right? We can do the Vanderbilt, but to diagnose ADHD, you need multiple settings. So it's not just what mom says, but we need to have teachers' input as well, multiple settings, so that we truly know if this behavior is maybe just situational, is it just something that's going on at home that we need to teach some behavior management skills, or is this truly ADHD, okay? So our therapists can diagnose with ADHD with a screener. They can do like a behavior rating scale, the BASC. And so when we find that this child has these characteristics of ADHD, maybe it merits further testing, and so we can then refer back to the school for further testing, or maybe, and I haven't been in the schools in a long time, but they have this process called RTI, right? Or the 504 program, so that way they can do their own evaluation to see if this child, qualifies for their interventions. So what is ADHD? It has to have 6 or more symptoms of inattention of children up to age 16. And as they get older, after age 16, they don't need as many characteristics. They only need 5 or more. For the individuals 17 and older. The symptoms of inattention have been present for at least 6 months. So it can't be, that they just started being distracted. They just started, not focusing, but they were fine before, because there may be some other factors that may contribute to that. And also because it's a diagnosis that's usually early onset in childhood, if you see an adolescent or an adult who all of a sudden presents with these problems, you probably want to rule out other things that may be causing it, because we know that most of the time it's going to be present from early on, okay? So it's not like as an adult you're all of a sudden going to develop ADHD. It probably would have been there already, but maybe it wasn't causing problems, or maybe there's something else like anxiety, or maybe some depression that's keeping that individual from concentrating. All right. Again, this individual often fails to give close attention to details or makes careless mistakes. They often have trouble holding attention on tasks or play activities. Often does not seem to listen when spoken to. It's really kind of heartbreaking to see that these children are always the one picked on, right? And so they develop then anxiety, because it's like, stop it, sit down, don't do that. And it's not just teacher, but mom and everybody. And so after a while, they feel like, what's wrong with me? How come nobody likes me? When in actuality, it's the disorder. So if we can educate them and tell them, this is what's going on and we want to help you. There's actually a really good book for kids called, it's Shelley the turtle who has ADHD, and it kind of explains it in child terms, what the diagnosis is, and that this little turtle has difficulty making friends because he's so impulsive and stuff. And so, so if you can find a book where you can explain it to them so that they can understand, yeah, this happens to me too. I have a hard time making friends, or, I break things and I don't really want to break them. It just like happens. All my toys are all broken. All right. They often does not follow instructions. They have trouble organizing tasks. They avoid to do tasks that require mental effort for long periods of time. They lose things easily. They're easily distracted, and they are forgetful.